There are two men in this room. Everybody else who is here is African American women. And we are the newest group of people who are who receive that diagnosis at a higher rate than African American men, white women, Hispanic women, men, African American women. And so the question becomes, why? Right? In relationships with our partners, we're always very trusting. We don't ask those questions. If we don't talk about it amongst ourselves, we definitely not gonna talk about it with the person that we are intimate with or potentially going to be intimate with. And just as you want to know that maybe not this is everybody, I'm just gonna put this out there. So just like you want to know the credit score, do you have a job? Do you have a car? Do you have a place to live? You need to be asking, what's your status? When was the last time you got tested? Have you ever gotten tested? How about let's get tested together? And we don't always ask those questions. And so, and even for us, as women, so Shay, I want you, and listen, ladies and gentlemen, I'm very interactive. So if you have a question, I want you to stop me. Let's talk about it. This is a very stigma-free conversation. Because as I said, a lot of times it's just one person waiting on somebody to ask the first question to get a conversation started. So our past lives with us. You know, it lives with us. So we have couples where he may have been an intravenous drug user. And, you know, he went on through life, got married, and then all of a sudden he tests positive, and now his wife is positive. Or we have clients who he's positive, she's not positive. So how they live now looks very different in making sure that they are safe. And so there is a medicine. Okay, wait a minute, let me go back. Who all in here is single?
Hey, me too.
Oh, that almost looked like it's complicated. Okay, so you're single, but who's in here married? Let me tell y'all something. HIV does not discriminate. It don't care if you are single or married or gay or bisexual or heterosexual. It does not care. It don't care if you're a man or a woman. It doesn't care. It just does not care. So even when you are married, you still should get tested. Why? Because you're not always with him or her all the time. So I'm a part of a group. I was talking about something one day, and this lady just blurts out and says, me and my husband got divorced because he slept with trannies.
Oh my.
But no, don't shush. But that's true, right? And so you're like, oh, because he's laughing over here. But let me tell y'all something. My first 6 months when I went to AOC, every day I'd be like, wow.
Yeah.
I didn't see that coming.
Yeah.
I didn't see that coming. I never want it to be the day where it's just all normal, right? And so, because things happen, things are happening now in relationships that when we were younger, it was like, yeah, we're not doing that. We're not doing that. We're not doing it. And then it comes with, now you're shaming me. If you try to have a conversation with me just about the lifestyle that I'm living, you're shaming me. And as one of my team members said, Miss Kelly, you gonna get us canceled. No. No, I'm gonna tell the truth.
Right.
You may not like the truth, but I'm gonna tell you the truth. Now, if you get canceled because of the truth, something's wrong with y'all, not me. But those are conversations that we have to be having with everybody. I heard you were in college. Lots of stuff happens on the college campus. Lots of stuff happens on the college campus. Whether you are involved in it or not, but anytime that you are involved in a relationship with a person who may be involved in some of that, you still put yourself at risk. All you need is a condom. But even better, listen, I'm just talking to you. I'm talking to every single one of us. Every single one of us. But there's this little pill. It's called pre-exposure prophylaxis. Is that right? It's called PrEP. You take the PrEP pill. PrEP is birth control for HIV. It is birth control for HIV. Yes, ma'am.
Well, my question is, with PrEP, has it been studies that can say what PrEP will do to my body 10 years from now?
Is there studies that will tell you what your heart medicine will do for your body 10 years from now?
Yes.
So, but let me tell you, because not everything is always tested on Black women.
That's right.
That's right. It's not always tested on Black women. So those studies may say what could happen, but was it tested on us? Because if you remember, Black women are left out of most of those studies. So when you see those commercials, there is PrEP, let me say that. There is PrEP that is better suited for us as women and Black women. Then there are PrEP medicines that you see on TV that say, if you, not for women, not for people assigned female at birth. I'm not quite sure how, there's not a line. There's not a girl or a boy line, but anyway. So those medicines have never been tested on women at all, because women are not even in the conversation. If you look at those commercials, it's mostly men. It is mostly men. And the idea that only men have HIV or should be protected from contracting HIV is absolutely preposterous. So that's why we're here.
Can I answer your question?
Yes.
I want to just answer.
But you gotta be louder, because I think we might be on somebody's Facebook Live.
Oh,
So you gotta be loud.
I just want to answer her question. So with PrEP, because they are studying it for women, and they do have different, like the pills, the vaccine. For African American women, we are leading right now the cases of HIV. So it's being studied on us. From what the classes that we've been attending, the most side effects that you have is the nausea for the first 2 weeks. But it's not really a long-term side effect. It's just like with the birth control. Most women be on birth control 10 years. There's side effects to it, but you may not have symptoms. Maybe the weight gain. But right now, what we've seen, you're not even seeing any side effects but nausea from the medication. And I think people are not wanting to take it serious or get on PrEP because they feel like, I'm not sexually active like that. I don't have multiple partners. You don't have to have multiple partners, because I see people every day that's in fully committed, married relationships. Their partner have given them HIV. So don't be like, well, it's not me. I'm not sleeping around, because you don't know. But it's really not a lot of side effects. And for women, it takes 21 days for it to be actively in your system, for you to be protected. For men, it's 7 days. But for us, African American women, it is being tested on us because we are leading the cases right now.
Yes, ma'am. Thank you, Shay.
In regards to the PrEP, I could be just kind of getting myself ahead of your speech today. But what is the time frame? Say you have a partner or a new partner, what have you, and you are intimate, but similar to like the Plan B. You know, the Plan B only works a certain amount of time, you know, after your exposure, so to speak, right? What is the time frame if you're not proactive and get the PrEP first? What's the time frame that you have to take it out?
So there is a Plan B for HIV.
Yeah.
Yes, there is a Plan B.
72 hours.
Tell me the,
You have to take it within 72 hours.
yes,
That's the PEP.
PEP. And then there is like, so that's two different things. So that's if you're concerned about HIV. And then there's a doxy-PEP that, let's say, if you have been sexually active with someone who may have gonorrhea, chlamydia, it's an antibiotic, just like amoxicillin or whatever that is, penicillin that you would do for any one of those sexually transmitted infections. So for us at ALC, when I went to ALC 3 years ago, everything in our building was about the rainbow. Everything was about the rainbow. And it was about being transgender, and that was it. There was no conversation around women. And we have a large clientele of women, specifically African American women and Hispanic women, that we see. But there was nothing there that talked to women. And there was a lady who came in who had been to Hughley Hospital. And she disclosed to the emergency room nurse and the doctor that she was HIV positive. And she brought in a gentleman with her when they let him come back. And the doctor, not knowing what her relationship was with this gentleman, wanted her to disclose her status. That was not her guy. But first of all, that's not your role as the doctor either. And so when she came into the office, she was really, really upset. She came into the office, and so she just kept saying, there's no place for me here. There's no place. Anywhere I go, there's no place for me. There's no place for me. And so we really start to have real conversations about where are we going to be in the space of helping, supporting Black women, right? And so from that, we started a program, and it's called Hey Sis, and we got funded to do this program, and we do it in partnership with AIDS VU, the Melanated Movement through the CDC, and with UNT Health Science Center. Dr. Trent Adams, who is the president of the Health Science Center, actually came from the Pentagon. She was part of that Surgeon General's team, and put together all of the pieces for Ryan White, the funding for Ryan White. And for those of you who don't know who Ryan White was, he was this teenage boy who just wanted to go to school. And because of his HIV status, he was not allowed to go to school. Ultimately, he passed away, but he was a strong advocate, he and his mom, for having funding for HIV for everybody. And so we get Ryan White funding, but through our relationship with HSC and the CDC, we do a program called Hey Sis. And so we now do PrEP and conversations with Black women, for Black women, and everybody that comes to the table looks like us. And it is a very real conversation. They are candid conversations, and you walk away knowing lots more then you came through the door. And that's why I was saying this should be a stigma-free conversation. You only need one person to raise their hand, and then everybody else kind of joins into the conversation. So at our clinic, we do STI testing, we do HIV testing, we have a food pantry, we do mental health counseling, we do HIV, we do STI treatment, not HIV treatment, but we are next door to the doctor and the pharmacy. We have a dental clinic. We do all of the full resources of case management, housing, transportation. We are literally one city block of all of the services that you need. We're Vegas. When you come through our doors, the most we're going to say to you is, "Good morning, how you doing?" You know, that's it. If we know you and you start the conversation with us, we're gonna have a whole conversation. Otherwise, it is good morning. It is good afternoon. And that's the way it is all through our building. We want people to be comfortable. Whatever happens in our building, it stays in our building. Except we had this one incident. And so this is the incident that I always get in trouble with telling. But I'm gonna tell y'all this incident because this is very real. And this is where our young people are. So when you have, I love that you are looking at me like my son looks at me like, "Grandma." But it's true. So we had a young lady and a young man who came in, and he said, the young man said, "I need to get tested, and my babies and my husband's baby mama needs to get tested." Okay, so we said okay, and I just happened to be downstairs that day, and I went upstairs and I said, "I don't think I've seen that one yet, but okay." And so over the course of like the next hour and a half, maybe 2 hours, the husband had come in, the husband, the baby mama, they were all positive. They said, "Who else might be, that you may have come in contact with?" They called the cousin and they said, "Well, who are you sexually active with?" And he said, "Him and him, and sometimes her."
Oh.
So the cousin was not positive, but we don't know how long he's gonna not be positive. The cousin was her cousin. Yeah, he was her cousin, and the cousin slept with everybody. And then it was like, "Well, what? This is a game. This is fun," and it's not, because the cousin sleeps with these 3 people, but the cousin also sleeps with other people, right? And then she's pregnant. And so, she has, another world. And that's what's happening. That's, yes, ma'am. Oh, I got 2 hands. Oh, that was like, oh my God, Chopper. Yes, ma'am. What you got?
Well, I was gonna, based off of what you're saying, it was, you talking about how, how it is today, and like how that, for them, it was like, oh, this is how we do it, kind of thing. So my question is, when all of this kind of came about, I remember being in college in the early 90s, right? And everybody was like trying to track back 7 years of who, whatever, making this, making it keep, it was that serious, right? But nowadays, it's nobody's even, like you said, talking about it or even giving it a consideration or making it a big deal. Like in the 90s, it was a big deal. Like it was a big deal. Like say every time you try to write down somebody's name and remember their last name 7 years ago, that kind of thing. But now it's just not discussed, like you said, and not talked about. And so I guess my question is, like, how do we get not just people our age, but younger people to also like begin, how can we get that conversation more socialized where people are knowing it? Because now it seems like you said, like this is okay, this is how it is today. But this can kill you still. It can make you sick. You can have this long term. Like, how can we get that over? Because also, as you mentioned, every person in that scenario that you just gave, every person, like when you sleep with somebody, you're literally sleeping with everybody that person has ever slept with, and everybody that those people slept with, and that number becomes a big number. Where you might have been thinking 7, that's really like 49 at this point. You know what I mean? Like, so how can we have the conversations with younger people, college age people? I have two kids in college and one headed to college. So how do we have those specific conversations? Like, this is not cool. This, you can have this long term.
You're doing it right now.
Okay.
You're doing it right now. And let me tell you, don't wait till they get to high school or off to college.
Right.
Because listen, little kids can tell you some stuff
Right.
that will turn you blue.
Because I talk to my kids, but
Yes.
I mean, their friends are not, their parents are not doing the same. And so
But do
I'm
they
just
hang
like
out
that.
at your house?
Well, when they do, I do have those conversations.
Yeah.
But when it's not, when they're somewhere else, those are not being had. You know what I mean? But when
Right.
I'm around, I try to bring up things that maybe they're not thinking
Yes.
Because I hear their conversations and
Yes.
what's happening.
And so that means that every one of us in here should be having those conversations. That's how we
Out loud.
out loud. Out loud. They're uncomfortable. They start off uncomfortable because even with my son is 22 years old, and I still say, you know, do you have, and he'll be like, Mom. So I just bring condoms home. Let me help you out. Let me help you out. There's a whole list of reasons why I'm going to bring these condoms home. Not because I'm worried about you having a baby. That's I can deal with that. But there are these other things that come with not being careful. There are all of these other things that come with it. Yes, ma'am.
I was just gonna mention, because you mentioned one lady was pregnant, right? And what I appreciate about God's divine purpose and his infinite wisdom is because I'm a sonographer. So when I'm dealing with women who are HIV positive, I know that as long as that baby stays within that sac, that baby is negative. That's one point I wanted to make. The second point I want to make, what about the Magic Johnson's wife, or in the 90s, this guy, he was an actress, and his wife died from AIDS. Don't some people carry a gene that suppresses them from getting HIV?
I don't know. Do they? I don't know. I don't know.
Oh,
I honestly, I've never, and honestly, until you just said that, I've never heard that. I don't know, but maybe Magic and his wife are a part of that group who have protected sex. Or, you know, maybe she's on a PrEP. You know, it could be any number of things. Because one of the things that you never hear about is they don't talk about Cookie.
Right.
They never talk about her, and you know, her status is her status. What does it say?
It says, yes, the most well-known gene associated with natural resistance to HIV is the CCR5 gene.
yeah, it's a gene. So Magic Johnson's wife and this particular actor, because of there's a certain type of blood, something within his blood and her blood that causes the AIDS or HIV virus to be like a repellent. I just want to share.
CCR5.
It's not a lot of people dealing with that gene. Listen, be thankful. Listen, I mean, yes, ma'am.
I just want to thank you, not getting ahead, but just thank you so much for sharing this. My mom, I'm from Houston, my mom retired from the city of Houston 20 years ago. And she worked in a clinic where all they did all day long was test for STDs and HIV. And so she would come home telling us these stories then, and she would come up to UT Southwestern to get their CEUs, and would leave the book with me when she would come up every year, and I would have the conversations with the kids and the parents that were too embarrassed. So thank you, because people you'd be amazed at how many adults are so uncomfortable with this and won't even talk to their own kids about it. So thank you.
I always say, my mom would always tell us, because my mom was older, and she would always say, if you kiss, you get pregnant. And I kissed Jamie Lane. And I kept waiting to get pregnant. You know, I kept waiting and waiting and waiting. I mean, you're looking at me, but when I was growing up, that was it. That was it. And that was it. That was the expense. You know, the expense of what that conversation was. And then I was like, okay, hold on. I'm gonna need a little bit more than that. I need to go read a book. Thank God for the library, because you can find that you know you can put anything, put some stuff in the book. We're not gonna find it because we're not gonna go read. I needed to read because I needed to understand, ma'am. That's not helping me. What you're telling me is not helping me. I need a little bit more information. And so we are on college campuses. We are on every campus of TCC. We're at Texas Wesleyan. We're at TCU. We are at UNT Health Science. We go wherever someone invites us, but we are on every single college campus every week. We are somewhere all week long. Yes.
I'm 21. My name is Darian. I think you know what I know. So, I love you a lot. I know you are uncomfortable. But thank you for it.
Thank you for being here. And it's not intended. I don't want you to cringe. What I'd like for you to do is when you go back, you live on campus, have a conversation. So let me tell y'all what I learned when I was sitting there with my mom and my auntie, and they just drug me out. Let me just tell y'all what I learned. You know,
Thanksgiving break.
on Thanksgiving break, you just be surprised at the number of questions that will then come from you just saying it. That's all it is. I'm gonna get her and I'm gonna come back. Yes, ma'am.
I actually have two questions.
Okay.
So in your story about this dysfunction of things, you said there was
She called it dysfunction.
dysfunction of things.
Did you hear that, Shay?
So there was one individual you said was tested, and your comment was that person was not positive
Yes.
at that time.
Yes.
So I don't know if this is something that you're going to go into, but talk about the symptoms and how soon. It may be different for different people, but talk about symptoms, when they may develop, and what that might look like. That's one of my questions.
So everyone's symptoms are different, you know, and when it starts. This is my example that I always use, and I think most of us here know this story. It's a Bible story. The woman with the issue of blood, right? The woman with the issue of blood didn't just wake up one morning and start bleeding. She had some symptoms, and she ignored possibly those symptoms. Maybe it was some spotting, maybe it was some cramping, maybe it was any number of things that led her to that point to finally start to bleed, and to bleed in a way that she was like, this is not good. But what would have happened if when she first maybe started having those abdominal pains, and you go to the doctor and you say something is wrong, I don't feel good, this is not right. Now, I mean, this is biblical times, but put us in that space. It doesn't just happen. There's some things. And as women, especially as Black women, we ignore the signs that our body gives us because I gotta work, I got kids, I gotta take care of my parents, I take care of, you know, all of these other things, and we put our health at the very end. And by the time for us as Black women, most times when we are diagnosed, we have AIDS. Because we've waited. We've waited and we've waited. So, and then the other part is we have to be our own advocates for our health. You know, if I go to the doctor and I'm telling you something is wrong with me and you blow me off, then I can't come back to see you. I gotta go find somebody who is going to take my symptoms and what I'm saying very seriously. Because we will get pushed aside, we'll get brushed off, so we have to be our own advocates. So for everybody, it's very different. It could be, runny nose, it could be the cough, it could be, anything. It just looks different, but don't discount it. Whatever it is, don't discount it because it starts and it may not always be the first thing that you think about, but as you're there, say, hey, can I get a test? Can I get an HIV test? And listen, y'all, ladies, gentlemen, we have rapid tests. We have take-home tests. If you don't feel comfortable, coming into the clinic, waiting for those results, you can take a test and take it home, mail it off, do whatever it is, follow the directions, and get your results that way. All of everything I'm gonna say this again because it's really important. Everything that happens in our clinic, it stays in our clinic. So when you get your results and you negative, we're like, thank you. Let's get you on PrEP. Let's start having those conversations. But here's a little kit. Here's a little toolkit. Let's get you on this toolkit. For us ladies, we're in January. We're doing a Hey Sis that says what's in your toolkit, and we have female condoms. We're not sure how to use these condoms. We're not sure what that is, but we're gonna have someone teach us how to use these condoms. Give us a demonstration because we have female condoms. There are female condoms out there. Shay is our PrEP counselor, and she still be looking like, I'm not sure what this is. And listen, we have them by the box load of them, and we don't know how to use them. And so if we don't know how to use them, I can't tell you how to use them. I can't tell you how to protect yourself, if I don't know how to use them. So, but they are available, so tune in, and we're gonna be live and we're gonna be live having this conversation. So I'm not sure where it's gonna go. I'm probably gonna be in trouble the next when the broadcast ends for my team. Yes, ma'am.
So, and thank you for that. So here's my second question.
Yes.
Earlier this year, I was listening to some statistics about STIs, and specifically with those over 50, but really in that category of those that may be in assisted living homes, being a larger number contracting STIs.
Yes.
So do you have any statistics or information about not what is going on, we know what is going on, but what is that number like? What is that percentage?
It's high, and let me tell you, it is high. When people say that, you're like, but you live in assisted living. I just might be 75, 80 years old. That does not mean that I don't want to be sexually active. And there may be one good man in the assisted living place that is the player. I mean, it's the truth. You say help me out. I mean, but and literally that number is really high. But let me tell you my other and it's not just us, it's them. It's older white people who are living in assisted living and Dexter lives there and Dexter, got it going on. And everybody and Dexter just, is up and down the hallway. And yeah.
And the dementia doesn't help, like in the assisted living home. My mom shared that with us as well. There's a lot of sexual activity in it because they don't know that that's not their spouse. And it's a lot of that.
Yeah.
But they may not have ever had a spouse. No, you just don't know. I mean, that's just, and have you, ladies in assisted living, they are dressed up and they're very becoming. They didn't just go to or not just even assisted living, but regular senior apartments. That senior life living. It's they look like you and me. They like, shoot, I'm still flying. I just don't live in my house. I live somewhere else, and I still want all of that attention, and I like what that makes me feel like. And you have this one person or two people. Viagra works.
Wow. I'm thinking when I thought of that is that I'm saying, because I didn't know there was a rise in singers and so I have a theory. Because if you're coming in, let's say you have 25 patients are in there, and out of the 25, you have 10 that are women and the other 15 sort of number. If they come in HIV negative, and then somewhere in their stay in the last 10, 12 years, they're HIV positive, that would mean that it's coming in to the facility.
Or it's already there.
Right.
Well, it could be, but my theory, and because I've known this to happen in several facilities, is that it's the staff. A lot of times the staff are being inappropriate with some of these things.
So you gotta check on your people.
Yeah. You don't, and you can't just put your people places and not go back and check on them, or just show up at Christmas time.
Right.
Or Mother's Day. I mean, you can't. But that's true. I mean, because you see that already in the news, different things that are happening. But you also can't discount the fact that, there's a gentleman next door
Dexter.
who makes his way around. She said, I can't take it. But hold on just 1 second. But in talking about sexually transmitted diseases, so remember when we were younger and you talked about syphilis. Syphilis was not like that disease that people got. If you got syphilis, something was serious. Well, now syphilis is on the rise. People contract syphilis at a higher rate than gonorrhea, chlamydia. Syphilis, so during COVID, and we're seeing these numbers now, when people come into our clinic, we're seeing those numbers from COVID. People being at home, well, on lockdown, not necessarily at home, but during the lockdown, and you're active. So those numbers are rolling in higher. So when I first went to AOC, I think my first year I was there, my first 6 months, we may have had 12 people who tested positive. Now we can have 12 people in a month, and on a good week, on a good day, the other day we had 2, just came in together. So those numbers, as people are starting to be concerned about their health and they're starting to get tested, those numbers are rising more and more. Yes. Okay, you had a question. Give me 1 second.
Before that.
Okay, go ahead.
So you said something earlier about, you being told you shouldn't be pregnant, right?
Yes.
And that was something that was common that you told kids to kind of keep them from cutting up, right? And you kind of waited, you threw out a name, Jamie Lane or something.
Jamie Lane.
Jamie Lane, okay. And you waited, right? And what it makes me think about is, because that was the method in parenting for a very, very, very long time. In some ways, I feel like that's the method that we use in the community when it comes to this topic. Like, don't do this, because if you do this, this is what's gonna happen. And then they do it, and then they escape it. And so they're just kind of waiting and waiting and waiting, and then negative and negative and negative. And so my question is, and I think Isha may have started this question in terms of college students and things of that nature. Have you, in your communications with them coming into your center or out in the community or what have you, are they sharing what they want to hear or how to speak to them in a way where they hear it and not dismiss it as, oh, people are talking to us again and it can't be, it's not gonna happen. I'm still not pregnant, so what? You know what I mean?
They don't take me.
Let me,
Hold on.
because
They don't take me. They take people like Shay.
Yeah.
So I have a whole 12-year-old team who goes out into the world and have conversations. Because you're right. Coming from me, I sound like your mama or I sound like the cool auntie. I mean, it's there's no in between. But Shay can go places and talk to people that I could never go, and and be received in a way that it does stay. And you're hiding back there in the shadows. So why don't
no,
you come
I
up
wanted
here?
to say this because she asked the question about how to talk to her daughters or the friends or whatever.
We can't hear you, nor can we see.
Oh my God. It don't be about being quiet. Okay, so I think she asked the question about how do you talk to your daughters or their friends and all of that. He's in college, right? The numbers for syphilis is high in the colleges. We go to different colleges Monday through Friday. And I just recently had a young black girl. She tested positive for something, came back, and she was retested. To a point I had to give her my number personally to directly talk to her because just tell them. Like, you gotta I just was honest with her. Look, I got an 18-year-old daughter. This is what's going on. You don't know, ask that boy, do he like boys? Ask him when the last time he been tested. These are the conversations. Like, I don't sugarcoat nothing. While she's trying to go to Prairie View now. When you go, if you're ready to date, get tested. We got kids. Take it with you, test them. Don't beat around the bush because it's serious. Syphilis is serious. We don't put it up there with HIV, but it's close enough because if you don't get treated, you don't know you have it, you can die from it. And I think back in the 90s, people were dying from syphilis, and they were saying it was HIV, but it's really syphilis. But if you don't talk, don't sugarcoat it. People are uncomfortable about talking about HIV, but I have tested 17, 18-year-olds. We can test at 17. They were positive. 17, the range right now is 17 to 25 African American women leading the cases of HIV. So you might not want to tell your daughter to get on PrEP, but you want to protect her. Same way you want to protect her from getting pregnant. Don't beat around the bush. Like me, when I talk to the girls that come in, we counsel, because we counsel everybody, even when we just test them from STI, we counsel. What do you see your life as? What do you want to do? Why are you sleeping with him without condom? Because nobody's gonna tell you they're positive. And I'm not gonna even lie. I have guys that a guy that's tested positive maybe for syphilis, and I know he sleep with guys. He still trying to talk to me. Like, are you crazy? Like, but you can't beat around the bush. And it's scary. But if you don't tell your children now, they'll never know. This is a conversation you have to have. And in the colleges, like I said, syphilis number is high. And they don't even know what it is. Like the young girls and the boys, they don't know what it is, where it came from. Sometimes I don't even know how they got it. So it's sad to even see them questioning me, dang, how did I get this? So have the conversations. Don't be scared to have the conversations. Like when they come to me, I'm talking to them like they my daughter or a friend of mine. Like, girl, you know that. So just have a conversation. Like, don't try to be nice about it because people are gonna tell you, I don't do that. I don't sleep around. I not me. I know my status. When we out in outreach and we begging people to get tested, a lot of people say they know their status, but do you really know your status? Because if you know your status, you can save somebody else's life. They don't really know. So definitely with the young kids, because young kids at 17 to 25 are testing positive for HIV.
How often do you recommend that we get tested?
No, that's it,
I would say, depending on how active you are, every 6 months. But if you know you not in a serious relationship, I ain't gonna even tell you that every 3 months now, because you don't know who your partner is. I see crazy stuff. She told you one crazy story. I see crazy stuff.
But even if you're not active, isn't there a period of time that doesn't it lay dormant or something?
That's nothing too. It's a myth about HIV laying dormant. No, because the test that we have, we test you from 21 days of the antibodies being in your system.
Okay.
So if you sleep with somebody 3 weeks ago, slept with someone 3 weeks ago, we can tell from our rapid test if you're positive. And if you tell me a story, I'm probably gonna draw you. I have situations like that too. Somebody may think they may be positive. The rapid may be negative because it's too soon. I seen your blood in, and some of them be positive. But you want to be tested within the 21 days. If nothing lays, no, it lays there because you haven't been tested in 10 years. People be like, oh, I had HIV from 10 years ago. You haven't been tested in 10 years.
Okay, so if you're not active, you don't have to be tested.
No, if you're not active, so if you haven't had sex over a year, but you tested before your last person, you should be okay.
Right.
Okay. It's not going to. So if you
for the record, cobwebs do get better.
But my question is, if you haven't had sex in 5 years but never been tested, you should get tested.
Right.
But if you've gotten tested within the 5 years and never had sex with anyone else, you're okay.
Okay.
I know Parkland provides us with HIV and AIDS testing like every 3 months.
So we do the same thing.
Okay, so the dormant thing was a myth. Okay.
That's what we have. Yes.
I think people say that because they don't test. So if you went at the point you done went 5, 6, 7 years and not be
17.
you have full blown AIDS at this point.
But I do remember hearing it.
Yeah.
Absolutely.
Yeah.
I mean,
Okay, but I want to tell y'all this. Here's what I want. Okay, when in the 90s, when people were talking about HIV, I think people were creating their stories as they went. Because if you will remember, it was the whole conversation of you could contract HIV from drinking after someone, or, drinking out of their glass or eating off of their fork or, and it was more of a scare. It was more of a scare tactic versus giving you good information, and now we're in a place where we have good information to give, but it's easier to remember the scare tactic information because that sounded scary, versus that's not true.
Or we just haven't gotten the updated information.
Right.
Because we don't
that's
talk
our
about it.
situation.
We don't talk about it.
Exactly.
And so now we're talking about it.
Right.
And so we need to, all of us, remember all of the crazy stuff and build on what's real and what's true. And what we do know is every single day, things are changing.
Right.
And so what may be true, 6 months ago may not be true today because we found out something different. I'm gonna come right back to you. Yes, ma'am.
So when many years ago when I was in the military and I was a corpsman in the military, we instantly knew who who was HIV positive, who had AIDS. It was right on the medical records. And we also were reading a chart that individual, once they found out that they were HIV positive or had AIDS, they had to share their status or they would be court-martialed. So my question for you is, for anyone that comes into your facility that has been, confirmed that they're HIV positive, do they have to sign a document stating that if they are sexually active, that they have to share that with their partner, or that they will be charged
Charged with what?
a crime?
Oh, no.
You don't have to tell.
No, no. And let me tell you something. HIPAA protects us and protects you. My team will get fired. And I don't mean a reprimand. What you will get fired for is violating someone's HIPAA rights.
And in the military now, they don't even put your status.
Yes. And so your status is your status. And you should be responsible for sharing your status. Now, what does happen, we have to report to the state. We have to report to the state. And somebody was talking about, you go back 7 years and you're thinking about all of your partners. Well, Tarrant County, they do the contact tracing. So they show up, maybe not, depending. And then they try to come and find you and talk to you and do all of that. Even still, that is so intrusive. And it makes you feel like you've done something wrong. So they're still trying to even figure that out, that piece out. And it's kind of like during COVID, when they were trying to figure out who you had been in contact with. Like, that's a lot. That's a lot.
And the reason why I'm sharing this here, because I kind of get anxiety talking about this HIV and all of this stuff, is because I was a girl in the military and had just met a friend who had a fiance. It was in 1990, and I would see her fiance, and I would say, "Oh my God, you are just getting so small," and he would just, "Hey, yeah, I'm losing weight." And I knew that this friend of mine, and how we met is because she had what you call a molar pregnancy. So she was pregnant by him. She was going through radiation because of this bad pregnancy, right? And so one day I'm in sick hall, and another friend of mine is getting ready to work on him without gloves. And then this guy named Ricky, he was like, "Oh my God, your friend, her fiance is, he has full-blown AIDS." And he was like, "Girl, what we gonna do?" So I was so shocked. I went up to my superiors, like, I know her. And they said, if you say anything, you get court-martialed. And I was so sick. And so this HIV, talking about this, it makes me sick to my stomach to hear, because this is someone that I knew personally that I could not tell her, because she had already been sleeping with this guy anyway for at least a year or two. And it just brings back such horrible memories, because not only was he sleeping with her, he was sleeping with like 7 other girls that I knew, plus one of the girls had syphilis. It was just, this is just like, it takes me way back.
So,
It's just
now listen, that was in the 90s.
That was in 1990.
Okay, so now multiply that in
It makes
2024.
my heart ache.
Because that's what's still happening in
Right.
2024.
Yes.
And the difference is now in 2024, he might be sleeping with 12 men
Right.
and 12 women. I mean, that's
The
what's
reality.
real. Yes.
I was just gonna, my question is, it sounds like it hasn't changed much, but how has the stigma changed? Because one of my very close friends, during college, she became HIV positive, and I remember her being pregnant and going to the hospital, and this was in the 90s, and once they found out she was HIV positive, they told her she couldn't be treated at that hospital. And I just remember her calling me crying, like it was a whole lot. So when I'm talking to my daughters, I have a whole lot of stories. I went to HBCU, I have a whole lot of stories. But in thinking about that and how that was for her, And even after having her child and having to wait like a whole year, I think it was, before he has like all his own blood or something and everything that went with that. It's just like, I'm just wondering, like, now, if somebody goes to the hospital and they know they're HIV positive, are they still turning them away? Or they have certain hospitals they can go to? Do they have, you know what I mean? Like, during that time, that was like not too much after the whole Magic Johnson. So, you know, like I said, it was like 91, 92, and this was the thing. And so, and I remember my boyfriend at the time, she was at my house and she was cooking and doing something, and he was like, I'm not eating that. I'm not gonna eat, and no, she touched that, and I don't want to be over here and this, you know, because that's what people were thinking, right, during that time, and that was the stigma around it. Like, I don't eat nothing, don't touch nothing, don't drink out of the cup that they had. And so I'm just wondering how much of that has changed. Part of it, I guess, is because they're not talking about it, so we don't know how much has changed. But like from a healthcare perspective, and especially in marginalized communities, like, where has that changed? Like, are people being forced to go to, you know, one hospital versus the other, or
No.
one place? Okay.
You can go anywhere you want to go.
Okay. So they have more information now, and they're not sending them away.
If I turn you away from my clinic, I have literally just put myself in the line of a lawsuit.
Isn't that protected? Aren't they, isn't medical protected?
It is, but you know, hospital, yes. However, so now, and you said something, I think the lady, you said, you know, without gloves. Well, it's gloves everywhere. It's gloves, it's masks, it's, you know, all of those things. Here again, it's no different than if you have any other disease. It's no different. And if you think back, like in the 90s, the EMS, they could decline to, if you were HIV positive, they could decline to transport you. The police wouldn't have to make the scene if there was blood. All of these things, that does not exist. That does not exist. And if it exists in some places, then they got a lawsuit. They just waiting for the lawsuit to come. But to talk about the stigma has not gone away. And we saw that here, just when you first talk about it, everyone, you clutch your pearls, right? And then you keep talking. That's what's supposed to happen. You are taken aback for a second, and then you move past it. So if I came to you and I told you I had been diagnosed with breast cancer, the first thing you would say is, oh, I'm sorry. What can I do to help you? I can take you to the doctor. I can cook you some food. Let me pray for you. If I come to you and I tell you I have been diagnosed with HIV, you step back. That has not changed. And it definitely has not changed in our community. As in truth, it has probably worsened, right? Because we still have not wrapped our head around the fact that our men sleep with men and then come sleep with women, that our women sleep with women and then go sleep with men. Our men have three or four women and they're in a polyamorous relationship. You know, we have not wrapped our head around any of those things and had conversations about them. And so this becomes the fallout from not having real conversations, right? And just still being stuck in the 90s. When I met my late husband, his sister had just been diagnosed with HIV. Well, in truth, yeah, she had HIV. Well, no, she had AIDS. But this was my sister-in-law. My sister-in-law was an intravenous drug user. And she had children by an intravenous drug user, right? And so if she was doing drugs, she was healthy. Healthy. The moment that she got clean, she would always be on death's door. It was the most interesting thing to watch. for almost 20 years. She be dirty, she be fine. She be clean, she be almost dead. And so the virus, it affects people differently. It does different things with different people. I'm gonna wrap up, but I want to, yes, oh, I'm sorry, yes ma'am, I'm sorry. Oh, and you have a time, I'm sorry, yes.
My
Yes.
question is, Shay mentioned that you could only test at 17, but we know that they are sexually active at a younger age.
In our clinic,
Oh, in your
in
clinic.
our clinic, in our clinic. Now, you as a parent can take your child wherever you want to.
Okay.
You know, but we, without parental permission, we can do 17.
So I could bring my 15-year-old daughter in your
Not to
clinic.
us.
Oh, not in your clinic.
Not to us.
Period.
No.
I would have to take her to a private doctor or hospital or something.
Yes. And Cook's is the hospital. Your private doctor, you can take her to the health clinic. You can take her to, you know, the public health department. You can do any of those things. But we see 17. Yes. Yes, ma'am.
So, can you walk us through, someone comes into your clinic and they test positive, what are the next steps?
Okay, so I want to go back one real quick. So on our team, we have a group, they are called peer advocates. And all of them are HIV positive, and they have to be willing to share their story. If you're not willing to share your story, you can't work on that team, right? So that's, and that team is a very dynamic team. It takes a really special group of people to come and walk through that. So you come in, we take walk-ins or we take appointments. You say you want to test. They test you for HIV. They take you, so you do fill out your whole form. Someone comes and gets you. They take you into an exam room because we have exam rooms. So it's just like we are a clinic. They take you into the exam room. I'm not sure what happened. They do your test. If you do a rapid test, how long does it take?
5 minutes.
5 minutes. So it takes 5 minutes. We have a room called the compassion room. If your test comes back and it's positive, we move you into the compassion room. If we're not moving people into the compassion room, we should be moving people into the compassion room. What happens is, so Shay is the tester. Shay then does a handoff to a peer. The peer comes down, so the person is never left alone. So, because you've just heard the most detrimental news that you can imagine at that moment. So the peer comes in, they do a handoff. 9 times out of 10, that person is really upset. Shay may or may not leave. They may want Shay to stay because now Shay is the person that they're bonded to at this moment, and you have a new person coming into this space. So then they start talking you through what's happening, but it's not an immediate talk through because right now you can't talk through. It may be 30 minutes, it may be an hour, it may be an hour and a half. If you telling me I gotta walk in a circle, I walk in a circle for a long time to just wrap stuff around, to make it sink in. So they do that, and then they get them connected to the doctor. They start that whole process. And then the peers for the next 90 days, and it's 3 appointments, they are with that person every step of the way. So if they are staying in our clinic, with us, between us and AHF, they are at every appointment. If they go to their own private doctor, which a lot of people can do, then we just do the follow-up calls. But we connect them to all of the resources, every single thing. Our services are based on your income. So we have 2 sets. We have people who come through the grant, And it's a sliding scale, so maybe 100% of your services are free, or you may pay a fraction of the cost. Or we have people who have insurance, because we do accept insurance as well. So we walk through the process.
Do you still have the housing? Is that still operating?
No, that's not us.
Okay.
That's Samaritan House.
Samaritan House.
Samaritan House does the housing. Yes,
Okay.
yes, where Steve does. Yes, yes, yes,
Okay, so after they go through all of that process.
yes.
What are these commercials that I'm seeing where they're saying that they have pills that they can take to where it's like it's non-detected or they
Uh-huh.
can't?
Where you're virally suppressed. That's your medicine.
Okay,
That's your medicine. So they go to the doctor. So they get set up, they go to the doctor, and it's no different than if I'm going to the doctor for my diabetes or my high blood pressure. I have a doctor. And there are specialty doctors, HIV specialty doctors. Yes, ma'am.
So I have a couple of things.
Mhm.
I have an uncle that's HIV positive, been for about 20 years. You would never know because he keeps his stuff. I don't know what the number is, but they're really low.
Mhm.
And he cooks for everybody. And so when she said something about that back in the early, when he first got it, everybody was,
Mhm.
but now you can't tell. He's very healthy. So you just never know. So you just looking at a person, you can't
You cannot tell.
The other thing is I work at a facility where I, like this weekend, Thanksgiving, I had someone who was stuck by a needle. So we have to make sure, since we don't know where that needle came from, if it was used, not used. Now I have to make sure she's prescribed our medication is Truvada and Tivicay. And so we have to monitor what that medication is only for 28 days, but we still have to monitor checking her blood for HIV and all those things for the next 6 months. But so yeah, that's how it goes. The other thing is we had a patient that came in who the mom was HIV, the baby was HIV, but I don't know, it was a husband, boyfriend, whatever, didn't know. So in the midst of that, the doctor's trying to talk in circles because dad's there, and he can't say, he cannot tell that the baby's HIV, mama's HIV. So in saying that HIPAA is strong. You can't, they will walk you up out of there.
Yeah.
You can't, and that was just hard because dads want to know, well, what's wrong with the baby? Well, what's wrong with my baby? And they can't say. So yeah, it's yeah, you're safe when they say you're safe and you can't speak on it. You can't. And it's kind of, it's a gray area in there because in that case, dad's trying to find out what's going on with his baby. What rights does he have?
And moms control it.
Yes.
Mom, we oh my gosh, I can't remember. Are they called daisies? I can't remember. Are they called daisies? Or marigolds? I can't remember. But let me tell you, and somebody has their phone, you can Google it. But kids who are born HIV positive and they don't know. And they don't always know until maybe they're teenagers. When they are coming into themselves and are starting to maybe become sexually active and things like that, and their mom tells them. I think they're called daisies. It's escaping me because we were just at a meeting and this young girl was talking about how she didn't find out she was HIV positive until she was 16 years old. And a lot of times then the kids don't start talking about their status because their mom has never told anyone her status. And so you just keep living under this cloak of, until somebody, one day just says, what the heck with it. But yes, and so we have several clients like that, who they're young people living with HIV, but they want to be involved in different programs, but because their mom has never disclosed her status, then that would be outing their. Yes, ma'am. You got a question?
So I wanted to say when, I usually was talking about stigma and how, whether it's changed or not. So granted, it is still very much still there, but there are a lot of things that have changed, like even, I work in organ donation, and so even, an organ donation, you can still be an organ donor if you're HIV positive through what they have a program called the HOPE program. And so that allows you to be HIV positive and you will be able to donate your, like, say, an organ to another individual who's HIV positive.
Oh, I thought you said, I was fine, I was say, oh, glory.
No, there are protections in place, but let me say to you all, this is not, while it's World AIDS Day, it's not a conversation that should just be had one day out of the year. It is the conversation that you take back to your dinner table, you take back to your friend group, you take back to the church. And our churches have to do a better job of having conversations, on things that are affecting our community. When I first went to work at ALC, I had a minister who called me and said he was really upset that I was promoting PrEP and that PrEP hurt, people's kidneys and their livers, and he went through this whole thing. And so he went on and on. And so I said, so you're not concerned that a man is sleeping with another man who's then sleeping with a woman? And you're not concerned that a woman is sleeping with a woman and then sleeping with a man? You really just concerned about their liver, their kidneys. That's what you're telling me. That you're concerned about. That's the part that you're concerned about. You're not concerned that our community, we are leading every category of every morbidity. You're not concerned about any of that. You're just concerned about this medicine affecting somebody's liver, their kidneys. That's what you're telling me. And he was like, well, sister, I didn't think about it that way. Please get out my phone. Get out my phone. Because I need you to be bigger in having this conversation. So we have a goodie table back there. Please take that goodie table, because Shelby will be fussing at me if I bring all of the stuff back. She will swear that I did not do any of the work that I was supposed to do. Yes, ma'am.
I was gonna say, can I say two little last things?
Absolutely.
One is that, just for information purposes, when people need to remember that when you're asking for STD tests or something, that it most times does not include HIV, and you have to ask for it separate. So don't just go somewhere asking for an STD test and think it's gonna be included, and it's not. The second thing is there are clinical trials being done. I work in clinical trials, so does Debbie. So we know that there are clinical trials being done. So we should, especially since a lot of the Black women are not going into the clinical trials. So if you know somebody, and there are clinical trials, I mean,
They usually pay.
yeah, they do.
They do, and they pay well.
So,
They do.
so go into, clinical trials, that's the problem. That's a whole nother conversation. No, I know. That's a whole nother conversation. It's a big deal now with Big Pharma, trying to get Black people, but also especially Black women into clinical trials. So just know that they are there.
And we're not always trusting.
That's right.
We are not always trusting. And so somebody has to step out. Somebody has to step out, and I'm not saying step out on the line and, but I think when we have these conversations and we recognize that we are not in that space, sometimes we're not in that space because we shy away from the space. And then we say, but you forgot about us. But I came and knocked on your door and you didn't answer. So I'm gonna leave that there. But I do have to, I have to give you my closing arguments because you took them. So yes, we do testing. And HIV testing and STI testing are two separate things. However, we do both of those sets of testing. We are open Monday through Friday, from 8:30 to 5 on Monday through Friday, and then 8:30 to 4 on Fridays. Is that right? Monday through Thursday, 8:30 to 5, and then 8:30 to 4 on Fridays. Closed Saturday and Sunday, but our testing van is always out in the community, so you can get tested out in the community for free. We do free HIV testing in the community. We have pamphlets back there that list all of the services that we provide. You can find us online at www.alc.org. You can go online and schedule an appointment. You can do all of those things. All of the services are listed there. And then the pamphlets have our phone number on there, so you can just dial directly into us. But see, I told you. She was concerned that it was not gonna work being interactive, and it went out great. So yes, so thank y'all all.
Thank
you.
you.
I appreciate y'all. Thank you. Absolutely.
Everyone, thank you. This has been very, 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 very educational. And as several of you have mentioned about the stigma and about us getting the information out, because the conversations are not being had. We hear about it, but what are we doing about it? And my call to action is, if you haven't been tested, go get tested. Take someone with you. It's confidential, and with the rapid test, because I don't know about Cassandra, but for me, that's one thing that I learned today, because I thought it was still the 10 years. So that's what I learned today. So go get tested. That's my call to action for everyone, and tell whoever else you know. And it's not about your sexual activity, whether you're active or not. Just go get tested. Thank you, and make sure you go shop, Doris.
Yes.
So shop at the bookshop.
Yes.
And did anybody have any other questions? I knew you were supposed to write questions down. Were you able to talk about everything? Okay, thank you so much.
Right there.
Oh. and then go to the table. Go see Shay. Shay wants you to. Please, go see Shay. Thank you, ladies. And then, ladies, we will see you on Friday and Saturday. Ladies, we will see you on Friday. We have a webinar. Carlene, what's the name of the webinar? Friday?
Unleashing Femininity in Leadership.
Unleashing Femininity in Leadership webinar. Please register, ladies. And then Saturday, Brigida.
We have the holiday celebration. Yep.
Holiday celebration at what time?
House.
At the Pancake House?
10 a.m.
10 a.m. How do we
Saturday.
come dressed Saturday?
For those who plan on coming and you plan on participating in the ugly sweater contest, come appropriately for that. One winner will win out of the ugly sweater contest. And if you plan on participating in the White Elephant gift exchange, bring a wrapped gift valued approximately at $20.
$20 White Elephant, and everybody needs to participate in this ugly sweater contest. And nowadays the sweaters aren't really ugly. No, they're 10 o'clock, ladies. And if you haven't registered, please register. And then can we get a picture together, ladies?
Yes.
Before you leave, ladies, thank you.
Okay.
Thank you.
Always